Welcome to another Office of Private Health Partnership videocast. Hi, I'm Mark Ember with the Office of Private Health Partnerships, which is an Oregon Health Authority agency. This is just one of many videocasts that we will be providing for you in a series to help you better understand the law and rulings of the Patient Protection Affordability Care Act and healthcare reform in Oregon. If you are not getting email invitations or notifications of upcoming presentations, please go to our website that is listed on your screen and click on Sign Up for OPHP's Email News, and you will receive our quarterly newsletters and invitations to our webinars, videocasts, and training events. Today's presentation will cover the removal of pre-existing condition clause on non-grandfathered individual commercial health insurance plans for children under age 19. Today's agenda will cover these key topics: background on the elimination of the pre-existing condition clause for children under age 19, how it impacts the marketplace, enrollment periods and types, other Oregon options for children, and our resources. Let me give you some background on the federal reform changes to pre-existing condition clause for children under age 19. As of September 23, 2010, federal health reform no longer allows insurance companies to deny coverage for children with pre-existing conditions. However, the law does allow insurers to limit enrollment to specific times of year, known as open enrollment periods. The Oregon Insurance Division filed temporary Oregon Administrative Rule, known as OAR, for these open enrollment periods. This rule applies to children under age 19 who seek insurance in the individual market only. Insurance companies, if they choose, may continue to offer coverage to children throughout the year outside of the open enrollment period. If an insurance company elects to do this, they cannot deny coverage for any child. So what is a pre-existing condition provision defined by Oregon statute? The provision applies only to a condition for which medical advice, diagnosis, care of treatment was recommended or received during the 6-month period immediately preceding the individual's effective date of coverage, which also includes pregnancy. So who is being impacted by this new federal law? The individual and entire group health insurance market, which includes self-insured and grandfathered group plans. In the group market, employers will have the option of emplacing a waiting period before their coverage goes into effect. However, the law states that it cannot be for more than 90 days. Let me explain how the open enrollment period will work in the individual market only. Remember, the group market is guaranteed issue and is not impacted by the temporary OAR change. There will be an initial open enrollment period from November 1st through December 31st of this year. Carriers will have 2 open enrollment periods each year during the months of February and August. On your screen, there are some additional enrollment periods, or known as special enrollment periods. This is for the birth or adoption of a child, or if a parent is getting divorced or legally separated, or the death of the parent where that child loses coverage. Healthy Kids has open enrollment all year for qualified children whose families are below the 300% of the federal poverty level. The Oregon Medical Insurance Pool, OMIP, or the Federal Medical Insurance Pool, FMIP, may be a viable option for children that have at least one of the 75 conditions that are listed on the application, which is available on OMIP website. The OMIP board voted on September 6th of this year to recommend that statute change be made to allow children under age 19 to enroll in OMIP or FMIP during non-open enrollment periods. If this law passes, it will take effect in the year 2011. If you seek additional information on this topic or want more information, I encourage you to visit the websites that we have provided for you. I want to thank you, and I hope you enjoyed today's videocast.